This is LiveWell Talk on COVID-19. I'm Dr. Dustin Arnold, Chief Medical Officer at Unity Point Health, St. Luke's Hospital. Today's weekly COVID-19 update podcast is being recorded at 8:30 in the a.m. on Friday, June 12th. The threshold of 1,000 cases was broken this week in the Linn County, followed by 80 deaths, but for the most part has stabilized, increasing very minimally over the previous week. We have had the milestone this week in the hospital of not having a patient on the ventilator related to COVID, and that goes back to March 27th. We've had someone on the vent each day during that time. We continue masking and universal screening upon entry into the hospital, practicing strict social distancing after being screened. This probably will continue through phase 2 as outlined by the governor in the state of Iowa. From a screening standpoint, we have done almost 3,000 screens through June 11th with only 29 positives. The emergency department continues to see an increase in patients, getting back to their baseline of about 150 each day, and the percentage of respiratory conditions is way below 20%. We are in phase 3 of the surgical restoration. A status of pharmacy, critical care, and personal protective equipment is in the green category. Unfortunately, the blood supply is yellow is noted for B positive blood, and O, positive and negative, is in the red. Red means there's 1 day of supply, and blood drives are being encouraged. And if you are a regular blood donator, which I am, that you should make an effort to get back to the blood bank and donate blood. One of the questions that I get frequently is whether or not there'll be a second wave this fall. I think that's highly unlikely for several reasons. One is there was no second wave with SARS-1. In 2003, there were focal or foci of outbreaks, but nothing that would be consistent with a quote, wave, end quote. And as I've stated before, even if we do have an increase in cases with things opening back up, it will not overwhelm the healthcare system. The second evidence regarding the absence of a wave in the fall is that New Zealand and Australia are not seeing a spike, and it's their winter. So it's their flu season starting down there, and we have not had a spike in that particular scenario. Often people compare this to the Spanish flu of 1918, which is an unfair comparison. It truly is an apple to an orange because coronavirus and influenza virus are two different viruses which have different characteristics and behaviors. We know what we do and we know how we do it. It's times like these we learn the why. If you have a topic you'd like to suggest for the COVID-19 pandemic, please shoot us an email at stlukescr@unitypoint.org. In the meantime, wash your hands, cover your cough, and confine yourself if you're ill, and practice social distancing.